the actual cause, direct cause of all of those symptoms that I just reeled off, and you'll hear me say them again and probably reel them off a little faster, is inflammation within the temporomandibular joint. Inflammation. And again, over the next series of podcasts, we'll have a lot to say about inflammation and how that causes each one of those symptoms. But I can tell you that I can show you, I can prove, it is in the literature, it is in the textbooks, that inflammation within the temporomandibular joint actually will cause huge numbers of headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, shoulder pain, arm, hand, finger tingling, and numbness of the arm and locking. Inflammation is the cause. Everything else after that is secondary. Secondary. It's a way about thinking about this. So I wanted to start the podcast actually at the end, because once you get to the end of this and you can actually realize and think that inflammation is the cause and everything else is secondary, it all falls into place. It all comes together. Makes total sense, and you can treat the patient, which is the second thing. So we're not just, oh, here's the cause, but we figured out how to treat it. 10 years ago, I gave up doing surgery for the temporomandibular joint. I can talk to you, and I may talk at length at some point about all my experience with surgery, but I did 30 years of surgery on the temporomandibular joint, at least well over 2,000 cases, half of them open joint surgeries, opening the joint, looking at it visually, and half of them through an arthroscope. During that 30 years, for the most part of it, I tried to do what my colleagues, the smart guys in research and people who wrote on this said to do, all kind of different surgeries. And what I found was sooner or later, some of them, in fact, at least half of them, half of those patients I operated on, we'd be back in my office. And they'd be back in with symptoms. And I already did surgery. I, didn't want to do more surgery. So 10 years ago, I literally put down the scalpel for surgery, and I spent all my career doing major facial stuff, cutting people's skeleton and face apart and putting them back together for various reasons.